Take in the small town atmosphere, be amazed at all that we grow. Like our kids that go and see the world and can't wait to return home. Drop a line in a placid lake or stroll along the shore. Take a tour on a peaceful country road, bound to be back for more. Oh, Norfolk, Norfolk, my Cousin County home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger long.
Everyone that our meetings are web streamed and televised, and if you could all please ensure that your phones are on silent mode. We will begin today with a special council meeting, and we will proceed, or my apologies, sorry, we've done the special council. We're going to start here with the Board of Health meeting, but I just want to remind councillors that we will need to proceed to the public hearings to begin sharp at 3 p.m. If the meeting does go beyond that, we can discuss reconvening at a subsequent date. So with that, I will now call to order the Board of Health. And are there any changes or additions to the agenda? Councillor Martin, go ahead.
Thank you, Chair Chop. I'm hoping to add on the agenda a discussion item surrounding our acting medical officer of health.
Okay, and we will need 2/3 for that. And Councillor Huffman, you are seconding that. And all those in favor? And that is carried. So with that, if I could have the a motion to approve the agenda, then with that additional item, moved by Councillor Martin and seconded by Councillor Taylor. All those in favor? And that is carried. Any declarations of pecuniary interest? Councillor Taylor, go ahead.
Thank you. I'd like to declare a potential conflict of interest on communications items A, B, and C, and any potential resolutions coming as a result. However, I do not perform eye exams. I am heavily invested in the eye care industry, so I think it's just right that I do declare that conflict. And Madam Chair, would you like me to step away for that portion, or is it okay if I just don't participate?
Yeah, I think just maybe turn your camera off, Councillor Taylor. That's probably fine. Okay, any others? All right, moving on then, we will begin with our presentation from Dr. Huckowich for his last medical officer of health update.
Thank you, Madam Chair. I guess I primarily wanted to talk about COVID immunization. I know that there's been a concern that our rates are lower than elsewhere. I think part of that is being corrected right now, because part of it was reflected in the fact that there were at least 2 postal code areas that were in our area that were being attributed to neighboring health units and not to us. And I believe that about a half of that error has now been corrected. And I believe that that has improved our immunization rates by a few percentage points. I guess the other thing that's happened recently is, since the province has announced their vaccine passport system, if I can call it that, there has been an uptick in terms of the number of people coming in for their first immunization. And so I think that's a good thing. So I think that's going to improve our local situation as well. In fact, I guess I'd like to just go further in the sense that there's all this talk about vaccine passports as if it relates to a document, a piece of paper or whatever. And I think that with that discussion, the major point has been missed. And the major point is that the province has finally come out and said to people, Yes, you can make decisions about whether you're going to be immunized or not, but those decisions have consequences. And they've formally come out and indicated that if you choose not to be immunized, there are going to be consequences to you. Apart from the disease, there are going to be consequences in the kinds of places and the kinds of activities that you're going to be able to participate in order to protect the larger community. And so it's not the piece of paper, the passport. It's the fact that the province has finally said, these are some of the consequences that will happen if you choose not to be immunized. So I'm hopeful that that will not only here, but I believe it's also happened in other areas, that it has kind of gotten more people to decide that they don't like some of those consequences of not being immunized, and therefore they're prepared now to go out and be immunized. So hopefully that will raise the rates not only here, but in fact around the province. The other, I guess the issue that I've been thinking about recently is, so what are the kinds of things that could improve immunization rates? And if you take a look at what other places have done, I guess primarily in the United States, I'm told that recently the governor of Texas is now offering $100 to everybody who gets immunized. There have been lotteries in some of the states up to $1 million, I believe, for people that are immunized. We have, I guess we gave out some T-shirts at one point. The province, I'm told, is not happy with people being provided incentives. I believe that at least one other health unit did offer hamburgers to teens in order to be immunized. But I guess I've been wondering, so what could be done to kind of locally or province-wide encourage additional immunization? Now, locally, I've only come up with one idea, and it would take a fair amount of work, unfortunately, and that is if we put aside a small amount of money, let's say $5,000, and I've got a check here for $250 that I'm prepared to put into it right away, we could have 5 draws in terms of people who have been immunized. It would obviously have to apply to everybody, not just new immunizations, but all of them. And that would mean we'd have to do a fair amount of work, because although everybody's given a number in terms of their immunization, it is not a local number. It's a province-wide number. So essentially, we would have to use some kind of a random number generator and then search, go through those numbers and find, let's say, 5 people who have been immunized locally and give them each $1,000. So that's one kind of thing that could be done. The board could encourage the province and the feds to provide additional financial incentives to people. As an example, there's no reason why the province couldn't offer some kind of tax reduction for people immunized, and the feds could offer some kind of tax reduction for people that are immunized. So I guess that's something I'd like to put on the table to see, if there's any board support for that. The other issue relates to the School Pupils Immunization Act. I'm told the Toronto School Board has just put forward to the province their support for having COVID-19 added to the list of vaccines that are required of children attending school. Now, clearly, it would only right now apply to those over 12, but probably by next spring, it will apply to kids as young as 2 or 5 years of age. And so that's another thing I'd like to put on the table for the board's consideration. Remember, other kinds of diseases that act covers are things like measles and mumps and chickenpox. While present, they are certainly a lot less prevalent than COVID is right now. And so here we have a disease, and granted, people can say, well, kids don't get terribly sick from COVID, so why would we bother doing that? But I'd remind people that polio, that 70% of the kids that used to get polio didn't have any symptoms at all. Another 25% of kids who got polio had mild symptoms, sore throat maybe, nothing more than that, maybe a bit of a fever, headache. Only 2 to 5% of the kids had some kind of serious condition relating to polio. And yet, we did very, very well in getting rid of that particular disease through immunization. So I put that on the table as well, because I certainly think that would encourage a lot better immunization amongst youth if it were part of the School Pupils Immunization Act. I had been looking at the issue of releasing school-based data in terms of our immunization rates. Unfortunately, it would take a lot of effort to clean up the data, because we still have kids, from last year that apparently attended one school. And if we were to have accurate information about what the individual school rates of immunization would be, it would take an awful lot of work on staff's part here. So I'm not quite sure that at this point would be a reasonable thing to invest in. We will be, however, investing in school-based clinics over the next few weeks to a month, and hopefully that will also improve our immunization rates amongst the youth. So I think that's really all I wanted to cover today, other than well, there's one other issue, but I'll leave that to the end.
Okay, thank you, Dr. Huckowicz. Questions from the board? No questions, comments from any of the board members? Councilor or Board Member Rabbits, go ahead.
Thank you, and through you. I wanted to touch on the immunization in schools, and I understand that another organization, another board of managers is responsible for writing this letter requesting it to be added to the list. Is there any way we can reach out to them and see if they are asking for a letter of support, or perhaps have them present at a future Board of Health meeting? Would that be in order, or what would we do to lend them support in having this virus listed? I would want to hear some more information, perhaps from one of their representatives, before tabling a motion for the board to do such a thing.
Yes, sir. Certainly, I think we'd be able to contact the Toronto District School Board and perhaps get a copy of the letter and provide that to the board. Certainly.
Board Member Vanden Rishi, go ahead.
Yes, thank you. Through you, I think that's an excellent idea. Anything we can do to encourage the vaccinations at the schools, and if you're making it a requirement, then I think, it's something that could be even more helpful. I think right now, what you're hearing is a lot of organizations are telling the students of 12 and up, if you want to participate in certain activities, I think you have to be doubly vaccinated. I know with minor hockey now, they're looking at that's a fact that you're going to have to be double vaccinated. So I think all these kind of things encourages them. Is there any possibility or discussion of having a clinic in the high schools?
Yes, we will be holding clinics in the high school.
Oh, excellent. That's excellent then. Thank you very much.
Further comments from the board? Member Taylor, go ahead.
Thank you, and through you, Dr. Huckowicz, I was just wondering if you would expand a little bit further on the administrative error that was going on, resulting in the incredibly low vaccination number. Just how did that happen? And
yeah. It related to two postal codes that the people with that postal code were being attributed to neighboring health units. And the bulk of the people in those postal codes, in fact, live in our area. And a large proportion of those people, in fact, have been immunized. So those immunization rates were being attributed to, to neighboring health units rather than to us. And so that, I believe, is been half corrected already, and it's a few extra points of percentages of immunization for our area.
Okay, thanks, Member Taylor. Dr. Huckowicz, did you want to carry on with the next portion?
The next portion being.
I thought you said you had something else to add.
I have one other thing, and that is, I think you mentioned at the beginning. So this will be my last board meeting with you people. I want to express my appreciation for your support. for the opportunity of helping out in this area. And you probably don't know, I have a multiple number of different hobbies. And one of those hobbies is I have what I call a lonesome pear tree in my front yard, and I've got an apple tree in the back. The pear tree I planted, the apple tree I didn't. In fact, I planted two, but one died, so that's why it's a lonesome tree. I make, since the fruit is not that great for a lot of purposes, I make a liqueur out of both my apple tree and my pear tree. And so I brought a couple of cases of my 2019 pear liqueur. It's served ice cold, could be served over ice cream. You can drink it like ice wine, whatever. And I've got a bottle for each one of you. I will leave it with Heidi in terms of the distribution of this material. So thank you.
Well, thank you very much, Dr. Huckwich. It was certainly amazing to find you, and you stepped in right at the time when we needed some help down here in Haltom and Norfolk, and can't thank you enough for all of your support. And I certainly take your comments in terms of approaching the province and the feds about some ideas for different lotteries for the vaccinations and so on to heart. I think that's something the board can think about over the next couple of weeks here, and we'll keep you posted with what's happening. And thanks very much for the gift, and look forward to hopefully maybe staying in touch here as things progress in the coming while. But again, can't thank you enough for all of your assistance on behalf of the board.
Thank you.
Thank you,
Thank
Dr.
you. Thank you.
Thank you, Dr. Huckwich.
Thank
you,
Thank you,
Dr.
Doctor.
Huckwich.
Appreciate your help.
Okay, moving on to, oh, sorry, if I could have a motion to receive the update as information. Councillor Taylor, seconded by Councillor Martin. All those in favor? That is carried. Member Taylor, I'll just get you to jump off for a second. So we have the 4 communication items. If I could have a mover and a seconder to receive those as information. Moved by Member Michelli, seconded by Member Rabbits. All those in favor? And that is carried. I have been advised there was significant communication on this matter that has come to my office and some others, that the clerk has drafted a motion that's been customized for Haltom and Norfolk, similar to the ones from Oakville and Fort Francis. Member Michelli, I see your hand up. Did you wish to move a motion regarding access to eye coverage?
No, Madam Mayor, I'm just asking about item 4 on the agenda, the adoption and correction of Board of Health minutes. Have we skipped over that?
Did I jump over that?
I believe we have.
Oh, my apologies. Well, can we just finish with the communications item?
Of
and then we'll
course.
come back to
Yes,
it?
thank you.
Okay, so is there anyone that wishes to move the motion for regarding access to eye care coverage? It would just be a letter sent on behalf of the board to the province. Member Huffman, thank you. And a seconder, Member Rabbits, any discussion on that from the board? All those in favor? And that looks to be carried unanimously. Moving back, sorry, my apologies, to the approval of the minutes. We have the minutes of February 2nd and February 24th special meeting before us. Are there any errors or omissions? Member Van Passen, go ahead.
I think your notes might be out of date. We should have July 6th and July 22nd. But the July 22nd closed minutes, could I move that they be released, please?
Okay, I will need a mover. So we'll adopt the minutes first. I think it's probably the best. I'm sorry about the dates there. I wasn't even thinking as I was reading that either. Member Michelli, did you have something else to add?
Thank you, Madam Chair. I did want to make a correction to the July 22nd minutes. The minutes reflect the Board of Health members who are present, and Board Member Taylor is omitted in that list. So for accuracy, I would like him added to that list, please.
Okay, thank you, Member Michelli. Kevin, you can make that correction. Okay, if I could have a mover then to adopt, moved by Member Van Passen, seconded by Member Michelli. Any further discussion on that? All those in favor? That is carried. And Councillor Van Passen, you have a motion on the floor to release the closed session portion of the minutes.
Yes, please.
And a seconder for that. Member Rabbits. And all those in favor? And that is carried. Okay, moving on. I believe we'll be at staff report. You can correct me if I'm wrong. HSS 2114 Vector-Borne Disease Program Update 2020-2021. And Ms. Van Dyke, I believe that you're making that presentation.
Yes, thank you, Mayor Chop. Through you to members of the board. This is an annual update report that is presented to the Board of Health each year to provide the board with an update from our environmental health team on activities related to vector-borne diseases. So I'm not going to do an extensive presentation of the report. As I said, it is an annual information report, but I'd be happy to try and answer any questions.
Any questions from the board? Member Rabbits, go ahead.
Thank you, and through you. I know that we've had some staff turnover in the health department, and I just wanted to ask about the position that would cover this program, and if there's any vacancies that maybe you could share with the board, just so we understand. And if that's more appropriate for council, that's fine. But I just know that we've had some key players leave that I've enjoyed working with, and I was just asking for a pulse check on some of those vacancies if they're not filled.
Thank you, Board Chair Chop, through you to Member Rabbits. The position of program manager with the environmental health team remains vacant. It is an ongoing posting, as you will see on the Norfolk County website. We have had some public health inspector positions become vacant and have been working to fill those. We're very fortunate to be a site for public health inspector students to do their practicum placements, and some of those students have decided to stay with us and come on board as staff, which is wonderful. We're really excited that they're making that choice. And so with all of the positions within health and social services, as they become vacant, we post them. And if we have some that, we're having a little bit of difficulty filling, then we keep them posted for a longer period of time until they are filled. And that's the case with the program manager position.
Any further questions? Thanks very much, Heidi, for the report. I think, a year and a half ago, this would have been a huge discussion item, Lyme disease and so on, but it's great to hear that there's still work that's going on with that in the background behind all of the COVID measures as well. So if I could have a motion to receive the staff recommendation as printed on page 26. Member Rabbits, seconded by Councillor Member Taylor, rather. Any further discussion on that? All those in favor? And that is carried. And Councillor Martin, I guess over to you.
Thank you, Chair Chop and colleagues. We've all been inundated with emails over the weekend and long weekend with regards to our acting medical officer of health, and I want to open this up for a very public discussion from the board at large. Here's what I know. I know we're in the throes of a global pandemic that has taken lives from Haldeman and Norfolk County residents. And I know that our hands have been tied previously with some of the public health measures, and our former medical officer of health was not fully achieving all of our public health concerns that we may have had as a board prior. So, in our search to keep the community safe and check some of the boxes on a go-forward basis with those community priorities, we needed to fill that role in an acting capacity, and we selected Dr. Strauss to work with us on a going forward basis. In the hiring process, we had some discussions around concerning the use of social media and Dr. Strauss and his freelance publishing, which we knew occurred, his articles. We were assured, I felt as though we were assured on a go-forward basis, views would reflect the responsibility of the position that Dr. Strauss would be filling. We also spoke about the power of positive messaging because he had such a substantial social media following. And despite comments made in the media that all comments were known and discussed in advance, I don't entirely feel that to be true. So I look to my colleagues to correct me if I'm wrong after I'm finished speaking. The comments that have followed on Dr. Strauss's social media since hiring are simply put not reflective of my position on COVID-19. They are not reflective of the type of leadership that I think our communities, both Haldimand and Norfolk, are in need of as we are lower in our vaccination rates. Glad to hear that we're not at the bottom. And lastly, I do not find that these comments are reflective of guidance that I want to be provided for our staff who've been working tirelessly in the health unit, for our family, our friends, our neighbors, and so on in our community. So while Dr. Strauss may use his social media to discuss the negative effects of lockdowns, and I do believe that that's healthy in a democratic society, there has to be a better way to do it than to lobby for changes that won't erode the public's trust or health or trust in our health unit, and won't undermine the efforts that our staff have taken over the last year and a half. Comments such as, promoting COVID over a Happy Meal for our children or live free and die are not the comments that I think someone in a leadership position for the health and safety of 110,000 people should be expressing. And I find the callous nature of the comments are infuriating, and I think they're a bit reckless. They're dangerous to our community. I don't believe this to be a political move. I believe politics is saved for property taxes and potholes. I believe this to be a common sense discussion about the health and safety of our community. So I've also read comments from Minister Elliott's staff expressing concerns over endorsing someone who doesn't support public health measures. That's a concern on a go-forward basis. So I'm looking to staff to open this up and direct us on some options immediately. And I also would like to turn it over to my colleagues to share their comments and have a fulsome discussion. Thank you.
If I could ask Councillor Martin, as the one person who is very much engaged on Twitter, I mean, we all knew that he did have a public Twitter account. And all of those statements, I mean, anybody could Google him. I would expect that every member of the Board of Health certainly had Googled him, especially when every member of staff, did talk about his social media accounts. Perhaps then I could ask why you voted to support him at the time, and because it was a resounding unanimous decision.
Sure. First of all, I don't wish to get in a one-to-one debate or justify my position. At any point in time, I'm able to articulate a change in a position, first and foremost. Second of all, I would like to open it up to my colleagues for discussion. We did discuss social media. I don't know what is appropriate to say here in open session because it was a closed session discussion, but there were many other tangible benefits to bringing Dr. Strauss online to work with us at that time that factored in. But there was a specific conversation, I believe I actually brought up his use of his social media, and we talked about whether or not we were going to have concerns and want to, silence that, for lack of better words. But there was not discussion leads on specifics of with our Board of Health on his position. These various things. We did not discuss the topics and the subject matter in the freelance articles as the Board of Health. You may have as a hiring committee, but I was not a part of that, so I cannot speak to that. But at the end of the day, these additional comments that have come after hiring him, like I said, live free or die, or I would rather give my child COVID than a Happy Meal. I don't care what was said before. I care about the health and safety of our community on a go-forward basis. And again, those comments are not reflective of my position, nor are they reflective of the leadership I believe we need right now. That would be my response.
Well, I think the COVID meal was actually prior to the hiring. I believe that's an older comment that's in the thread. So certainly I would expect, just as our HR did a vetting and Googled individuals, I would expect, especially when all staff members discussed concerns, but continued to support the hiring, that council members are also responsible for doing some research and so on. I don't think it's a matter of being spoon-fed every topic that's on there. It was very public, and you even mentioned how many thousands of Twitter followers that he had that day, as I recall. So Heidi, I don't know if you want to make any comments or.
I'm not interested in getting in a debate with you. I respectfully ask that you would allow our colleagues to speak to it and not rebuttal to every single comment.
Well, I also am supportive of having the truth out there, and I think it's insulting to our staff to suggest that due diligence was not done in this case.
Let's allow the colleagues to speak.
Councillor Martin, I'm the chair of the meeting. I'm going to pass it over to Ms. Van Dyke if she would like to make some comments, and then I can go around the room.
Thank you, Chair Chop. I just want to note that Ms. Anderson is on the call today as well, and can correct any of my comments in relation to Norfolk County hiring practices. I want to assure the Board of Health that from the beginning of this recruitment, we followed all Norfolk County recruitment processes to the letter, and that the conversation and that happened in closed session, and the information that I shared with the Board of Health at the time, that I stand behind that I made a thorough assessment of the two candidates, that I shared my assessment of the candidates with the Board of Health in an effort to support the Board of Health's decision making. And I still believe everything that I told the Board of Health in that closed session and everything that I shared with the recruitment committee during the second interviews.
Thank you very much, Ms. Van Dyke, for those comments. Member Vanden Rishi, go ahead.
Thank you. I want to make it very clear, when we were having the recruitment meetings, Heidi, I have to say, I never once received any paperwork or any documents saying what the Dr. Strauss's comments were. I'm not a Twitter follower, so I don't go on Twitter. I'm not a human resources staff member, so I didn't find it necessary to vent this individual. I thought that was being done. Never did I receive anything on paper or from you, Heidi, that any of his comments, only that he made comments. So to me, this is very disturbing to say that we all knew. Unless we're Twitter followers and go on Twitter or have a social media page that relates to this type of thing, we wouldn't know. And I don't think, as a counselor, it is my job to vet these people. I think it's a job that has to be done by staff. And I just don't understand how a person who makes these type of comments, I would have appreciated an example of a comment, and I never ever received one. So I thought, after I've heard some comments from others, that maybe I missed something in the meeting. So I went back and spoke to a couple people, and I went back and looked at my notes. Nor did they see anything in writing or comments said, actual words of what these Dr. Strauss's beliefs, comments, and whatever were done. That's my comment, and I'm going to stick to that.
Wow.
I am very, very upset, and my phone doesn't stop. People don't stop. They're very upset. But to say that we knew exactly, that would mean we'd know what his comments were. I did not, and I'm not a Twitter follower, so I'm very, very upset with this entire process of the human resources vetting.
Member Vanden Rishi, I would like to defend our staff at this point in time. It was indicated at the meeting that there was 20,000 Twitter followers, that he had controversial. I am the chair of the meeting and I'm speaking.
Good luck.
He has 20,000 Twitter followers, that he had published controversial articles. Staff at both meetings, including the subcommittee, which you are a part of, Haldeman staff also spoke to the matter. And I'm sorry, you are also given a tablet by the taxpayers of Norfolk County, and I would think that you would know how to Google. And so if you haven't gone and done your own research after staff suggested that there were controversial writings, I think some of that responsibility does fall on yourself. Councilor Shelley, go ahead.
Let me tell you something. I will accept the egg on my face for this situation, but I'll tell you something. Not one document was given to me with what was said by this individual. That would have been something for further discussion or further review, but I did see nothing.
Councilor Shelley, go ahead.
Thank you, Madam Chair. I have to concur with much of what Board Member Martin and Board Member Van Andrieschie have said, and I am certainly quite willing to take all of the responsibility for the decision that I made at that time. That I now look back with some, hindsight, that perhaps I should have asked more questions. I suppose, in a sense, my focus is on the amount of pushback we have received from the community at large. I certainly have to keep in mind that some of this, if not much of it, is new information, and I certainly would not fault our staff in a sense because I was not part of the subcommittee. I wasn't privy to those discussions or those interviews, but I certainly placed a great deal of confidence and trust and in our staff that they had done all the proper vetting, and it was only subsequently when we began to get emails that I did a lot more research, and I did follow Dr. Strauss on Twitter, and you are correct about what you said earlier, that many of his comments are perhaps a little old, but some of his comments have occurred in the interim since that July 22nd meeting, and I do have to give as much weight as I think it deserves to the number of citizens, of residents of both Haldeman and Norfolk who have expressed their grave concerns. And I would be quite willing to reverse my course on this, and I would take the responsibility for doing so. It's not because I want to change my mind necessarily and try to come up with some kind of excuse for why I'm doing it. I think that the public has spoken. I want to, as a board member, the residents of both counties, and I want to make sure that the vast majority of the countless emails and phone calls that I know all board members have received are not in favor of this appointment. And for me, in the end, I think democracy should rule the day, not the personal opinions that one individual board member might have, or the personal opinions that are expressed on social media. I have to totally support, again, I support our staff. I think that they did the best they could, but I agree with Board Member Van Andrieschie. It would have been nice, frankly, to have seen a little bit of documentation about what the concern was with the social media. Thank you.
Member Michelle, I'm just going to put this to you. I'm just wondering if you received, I had Natasha send them out to councillors. The one thing I will say, he is a member in good standing with the Ontario Medical Association. He's employed as an ICU doctor. He is also employed by Queen's University. Your staff that work for you fully endorsed him and vetted him. And your current acting medical officer of health, who's had a good relationship with the province, also endorsed him at that meeting. So I guess for me, it goes beyond simply, some people without a scientific background to question an individual like this. I think having differences of opinion is what makes the world go round. And in terms of the safety of Haldeman and Norfolk County, I believe you all received a letter from Dr. Strauss today that he has a legal obligation to follow provincial orders. And so if the province chooses to issue another lockdown again, Haldeman and Norfolk will also be in a lockdown. If the mask mandate continues, Haldeman and Norfolk will also be part of that mask mandate. The issues that the Board of Health has had over the last year and a half have actually been orders not issued by the province, but particularly orders that have been issued at a local level. So again, I also don't think it's fair when you have Heidi that has stepped into this role that supports her decision and continues to support her decision. You have members of the medical community that are also supportive of this individual to say that somebody is not supposed to have a different opinion. We have all criticized a number of the lockdown measures ourselves here in Haldeman and Norfolk. Go ahead, sir, if you want to come back again.
Thank you, Madam Chair. I am not questioning or critiquing Dr. Strauss's credentials, and I am sure he's a fine man. Maybe part of the problem is I have never met him. I've not spoken with him, but I do know what I receive as information. And again, I want to reiterate, I am in no way criticizing our staff and the job that they did in vetting this individual. I do want to make sure that the Board of Health reflects the majority, and in this case, I would say the vast majority of the citizens of both counties who have some concerns about this selection. Thank you.
Member Columbus, go ahead.
Thank you, Madam Chair. And just a couple of questions here. One being to Heidi here. Once we made the selection of Dr. Strauss to lead our medical officer health position here, did you communicate with him our expectations with respect to some of the controversial writings that he had put in social media? Was that communicated to him?
If I can jump in here, and Heidi, you can comment as well. I mean, I don't know what happened between staff and Dr. Strauss, but when I wasn't even aware of the exact timing of when we were going to put the release out. It had been prepared, but I did reach out to him and asked him to cease any of the writings, and he has certainly agreed to that. And I believe he also wrote that into a letter, which he published in the Maple Leaf, but also sent on to the board today, as well as refuting perhaps some of the libelous comments that have been sort of, taking statements out of context that have been made online. So he has given me his assurance as chair of the board, and he's also sent it to you in a letter now that there won't be any further communications. Up until that point, he wasn't actually employed by us, so I certainly didn't have the conversation with him, but I'll let you comment further, Heidi, if you like.
Thank you, Mayor Chop. It was not included as a condition of his employment contract. I believe that it was discussed clearly during the second interview, and the question was answered, and he gave a very clear response. So I took that as the issue having been resolved.
Thank you, Heidi.
And if I could, I certainly respect the comments that are being made related to a wish to have seen written materials related to social media, and I respect that. The concerns about his social media account, again, maintaining the confidential nature of the hiring process, those concerns were not brought forward by myself or other Norfolk County staff. And so I did not have written copies of that material. Certainly that is something that if that had been requested, I would have provided. And I think perhaps, this is something that maybe as a corporation, we need to look at going forward in terms of our recruitment process, because certainly I would wonder, not being an HR professional and not being a lawyer, I would wonder whether when candidates apply for positions, if we would need to inform them ahead of time that an official online search would be part of the recruitment process, so that they could be expecting that. Certainly that was not communicated to any of the candidates point during this recruitment process, because that has not been part of the outlined process that we follow. So just to be clear, if I can have a moment to review that with the board, there was a public posting for the position. When the posting closed, we reviewed the resumes of all of the candidates with our colleagues in HR. Those that were determined to meet the qualifications went through an initial screening interview with myself, the director of HR, Ms. Anderson, and the CAO at the time, Mr. Burgess. Based on those first interviews, there were second interviews with 2 candidates and the subcommittee of the Board of Health, as determined by the Board of Health, and the members that were appointed by Haldeman County. There was a very, I would say, comprehensive and specific closed session report that was presented to the Board of Health with comments from the subcommittee members. There was a fulsome discussion and a decision made. Respectfully, staff were not asked, based on the concerns or the questions that were brought forward, to go back and do an official search online or of social media and present those findings to the board. Certainly, if that was something that, as council, council wanted to be part of the HR process going forward, I would suggest that would be a conversation that could occur at council.
Shelley, I
Madam
see
Mayor,
your hand is up, and then Councillor Van,
my second question, Madam Mayor.
Sorry, Councillor Columbus, I would just like to give Shelley the opportunity to speak.
Okay, great.
Thank you, Chair Chop. Just to follow up through Councillor Columbus's inquiry regarding social media, the county does have a policy on social media for employees, and that policy and all of the other onboarding items would be presented on the first day the employee starts with the organization. So on September 14th, there is a robust HR onboarding process, and one of the items in that is our social media policy, as some reassurance as well.
Go ahead, Councillor Columbus, with your next question.
Yes, my second question to Heidi was, with respect to the employment contract, where are we with that? Is it completely signed, and is there a provision in there about the social media issue?
Mayor Chop, before I answer that question, I see that Kevin has his hand up as the clerk. Would it be okay if we just let him speak in case he has some procedural advice for the board?
Kevin, go ahead.
Thank you. Through you, Chair Chop. I just want to caution both the board's discussion to refrain from going into the specific hiring deliberations, and those matters should be kept confidential. I do not recommend going down that route right now without going into closed session.
Mr. Clerk, I respect your decision.
I don't know. I think, Kevin, I'm not sure why that would necessarily needs to be confidential here in terms of the discussion of whether or not he has a signed agreement. I mean, if that's something that would be FOIable.
I would like to refer to Paula. She's having her hand up.
Good afternoon, members of the Board of Health. I have to admit that I'm not clear on whether such a thing would be FOIable, and I would defer to the clerk's office about that. I just wanted to suggest that to the extent we're getting into specific discussions about any employment contract, it would be my recommendation that that just occur in a closed session. That's all.
Can we just take a 2-second break here? I just want to discuss with the clerk for a second.
I imagine we'll have to recess. We have another meeting taking place at 3.
You're probably right, but we should try to keep things going.
I would say that this conversation should have just happened in front of everyone.
Okay, the clerk has just verified, so we can disclose that the contract with Dr. Strauss has in fact been signed. She just cautioned against discussing particular details of the contract, but I think as Shelley articulated earlier, it might help to answer your question outside of the provisions of the specific provisions of the agreement, Councillor Columbus, that all of Norfolk County and of the health unit have social media provisions, code of conduct that they need to abide by. Further questions? Councillor Hoffman, go ahead.
Thank you, Chair Chop. I just want to start out by saying that I'm at a point in my career and a point in my life where I'm able to take ownership for when a mistake is made. I'm fully taking responsibility for making a mistake. It's a shame, and it's extremely regretful that this has turned into a council versus staff issue in terms of the vetting and things like that. I was a part of both meetings, and I can tell you from the joint meeting with Haldimand County, there was a mention of his publishing in journals, and that is all that was mentioned. That is it. There appears to be some mistaken truths that have occurred today during this meeting. Over the course of the weekend, I've spoken with educators, physicians, business owners, seniors, parents, first responders, and lawyers, all members of our community. And they are aghast that this is who we would be putting in charge of our public health in Haldimand and Norfolk County. The vetting process, I'm sorry, we just went through a hiring for a CAO. We weren't a part of any of the integral parts of vetting for the CAO, nor would council be expected to be vetting for the medical officer of health. So at this point in time, and I would like to make it noted publicly, that we have the support of 3 Haldimand County councillors who would like to see this appointment revoked. So at this point in time, I am wholeheartedly, without any doubts in my mind, revoking my support for Dr. Matt Strauss as the acting medical officer of health for Haldimand and Norfolk County.
Just to be clear, though, I wanted for the record, the Twitter account was discussed because I distinctly even recall the discussion over the 20,000 followers. So social media was discussed. Kevin, if you'd like to go ahead.
Through you, Chair Chop, I see that Paula also has her hand up, and I'll defer to her.
Paula, go ahead.
Sorry. I guess I just want to say at this point, I'd like to understand what the hope of the Board of Health is. That is, if you have an interest in discussing your original decision, if you have an interest in reconsidering that or your processes around that, maybe the right thing to do is get a little bit of legal advice and have a conversation with myself and the clerk about what that could look like. And then you can come back and make your decision and open about what you want to do one way or another. I'm just a little uncomfortable with statements one way or another, I guess I'll say, about the current status of this relationship with the corporation and the health unit more particularly. So that would be my suggestion, is that if not today, then a special meeting, I don't know, but something that allows for a fulsome conversation with some legal advice, both with myself and your external lawyer who is mostly responsible for your HR matters.
Okay, did Teresa, did you want to weigh in from the clerk's perspective here on this matter?
Through Board Chair Chop, I agree with Ms. Budis that we're at a point where I believe these discussions are on the line of identifiable individuals, labor relations, and requiring solicitor advice. And I agree that these are discussions that should be held in closed with the respectful legal counsel in attendance.
Okay, so do you require any, are we looking for a motion for this? Or a reconsideration then to even direct staff to go and do that, Teresa? I mean, I think that's the question. I'm not sure, as we've discussed, that you can reconsider the hiring of somebody that's already, if it's gone pretty far down that path. But I also don't see the ability just on a vote of 5 to go and start directing staff when we have. So how would you like to handle it moving forward here?
Through the chair, my advice would be we need to go into close to discuss this matter. I don't know that we need a motion to do anything but go into close to have some conversations with respect to the matter. And if we require the legal counsel, which would be our in-house, and then if we need our external legal counsel, we would have to determine that availability to have conversations around the matter to inform the board of different options and matters pertaining to this prior to making any determination in closed would be my best advice.
Okay, so I think it's 5 to 3, so I think we'll have to adjourn then and reschedule a special council meeting if to be able to go into a closed session. Councillor Rabbits, I'll give you the opportunity since you didn't speak already.
Thank you, and through you, I was hoping to recess the Board of Health and provide staff that direction that we reconvene following our Public Hearings Committee to receive closed session information.
Okay, is there anyone that hasn't spoken from the board that wishes to speak? Member Taylor, go ahead.
At this point, I do think we do need to have a much more fulsome conversation before we make any hasty decisions in this situation. I don't think the material of his hiring has changed. I mean, we have staff still saying that he is the best candidate, regardless of the social media attention he's received. And like it's been stated before, his legal obligations wouldn't change, and those legal obligations are incredibly serious. Whether or not he has an opinion one way or another on the idea of a lockdown. And like it has been said, we all sat and criticized harsh lockdown policies last summer. I think we do need to have a much more fulsome conversation around the, so I think the recess is in order as opposed to going that direction right now. I think we do need to have a more fulsome conversation.
Okay, so Teresa, did you want to reach out to external legal first to determine when they're available, or how did you wish to handle the scheduling of the meeting, or did you want to plan for it tomorrow at 1 o'clock? What's
through the mayor? Through the chair. The scheduling of the meeting would be subject to the board's approval. Just a couple things to keep in mind, and I believe Ms. Anderson could confirm this, but I understand the external legal counsel that we have only has 2 availabilities this week. The first being tomorrow after 5:15 p.m. and Friday after 11 a.m. My suggestion would be, if we are having a special meeting to hear this matter, our typical procedural bylaw is 48 hours, but if if the board so chose to waive the procedural bylaw to allow for an earlier meeting, we would recommend a 24-hour notice so that we can notify the public in an open and transparent manner of the decision. But again, that would be at the board's discretion.
comments from anyone? Councilor Martin, go ahead.
Thank you, Chair Chop. It would be my preference that we recess this meeting, go into our our public hearing and come back to this meeting and hear from our in-house county solicitor, as well as go ahead and book in for tomorrow in the evening with external and make sure we're staying on top of this.
Okay, so we'll move to the discussion this evening, and then we can decide on the next component after public hearings. I guess with that, we can recess the Special Board of Health until the conclusion of the Public Hearings Committee. So we'll take a 5-minute break, and we'll see you back here at 5 minutes after 3.
Quickly, there's a new link for Public Hearings Committee.
Okay,
I'll flip everyone the invite.
Thanks, Kevin.